Maslow has identified a hierarchy of human needs. Human behavior is motivated by efforts to meet these needs. The 5 categories are ranked in order of importance for human fulfillment. Level 1, physiological. Level 2, safety and security. Level 3, love and affection. Level 4, self-esteem. And Level 5, self-actualization. Remember, life is a dynamic process that involves movement up and down the hierarchy in response to events in our lives. An individual's behavior at any given time is also impacted by that person's personality, the current situation, and the opportunities available. True or false might be a test question. It's necessary to fully meet each need before moving up to the next level. That is false, because life is a dynamic process. Illness and injury alter human needs, and full recovery may involve moving up the hierarchy. The role of healthcare professionals is to recognize the patient's needs and help patients meet needs at each level. In healthcare, responses to perceived threats are frequent, and defense mechanisms are one way to handle those threats. Defense mechanisms do provide temporary relief, but they don't resolve the underlying anxiety producing that needs to be addressed. They're commonly used, however, at times of stress like illness and injury. As a healthcare professional, you should demonstrate acceptance, show sincere interest in patients' well-being, provide education and instructions to increase the patient's control over their health issues. This is very important. It creates a lot of anxiety when you lose control, so being able to give back some control to patients is very helpful. Allow patients to discuss what is really bothering them, and respect their need to use the defense mechanism because it might help them get through a difficult time. Here are examples of the defense mechanisms. Compensation is meeting a need through substitution, like something sweet to eat. Control is using inappropriate control to make up for loss of control elsewhere. So your house has to be neat as a pin because your life might be out of control somewhere else. Denial is pretending something is not true. Displacement is transferring feelings about one person to another, and acting out is expressing difficult feelings with extreme behavior. Malingering, pretending to be ill. Projection, seeing your own weakness in others. And rationalization is explaining away your behavior with a socially acceptable reason. Regression, going back to an earlier age and using inappropriate behavior for your actual age. Repression, keeping your unpleasant memories hidden away. And withdrawal, refusing to communicate or engage with others. So these are ways to deal with loss and other stressors. Losses occur quite often in healthcare. A loss can be a death of a loved one, but also a loss of independence or physical ability or good health or privacy or financial security. These are all losses, and they can significantly influence your patient's behavior. Healthcare professionals can help patients deal with loss by understanding the importance and giving patients the opportunity to share feelings, and perhaps helping patients explore ways to deal with loss. There are certainly many ways to deal with loss, and an individual needs to find what works for them, but here are a few. Seeking support from family and friends, finding comfort in religion, drawing on self-esteem, using problem-solving techniques, defense mechanisms. Not as healthy for sure, but becoming angry or depressed is certainly a way that some deal with loss. So all in all, we need to understand that to be effective, we have to be understanding and respectful of the differences in our patients. We need to understand that patients have different perceptions of health care in terms of what is health, as we described before, and what is appropriate care as well. We can observe patients' behaviors and how they interact with others, determine whether language barriers are present, and certainly ask questions to learn about individuals' preferences. You should listen carefully to your patient's response. Some patients need more information than others. Explaining what is being done and why is very important. Question. Might be a test question. Is it appropriate to ask patients directly about their healthcare beliefs? It certainly is, but it should be done in an inquiring manner rather than judgmental. And it's now time to move on to the response to this mini lecture.